Good afternoon, everyone, and welcome to Caraconference 2022, the impact of community-led approaches. I'm Adam Riley, Prevention Manager at Caracol. Before we get started today, I have a few housekeeping issues that we're going to go through. So first, Caracol is Greater Cincinnati's HIV service organization devoted to positively changing lives in the fight against HIV through prevention, housing, and care. For more information, visit caracol.org. And to participate in today's webinar, use the chat function for any technical questions or issues if you want to introduce yourself or share information. But if you have questions for our panelists or presenters, please use the Q&A function. We have people monitoring that in the background. And if you're joining from a mobile device, you can access the chat function by clicking the 3 dots more button at the bottom right of your screen. And you can access Q&A by clicking the white Q&A button at the top right of your screen. And thank you to our sponsors. Presenting partners today are Maytech, Midwest AIDS Training and Education Center at the University of Cincinnati, and AETC, AIDS Education and Training Center, with sponsorship from Gilead. And today we have a quick message from Gilead. Support comes from Gilead Sciences, a research-based biopharmaceutical company whose mission is to discover, develop, and deliver innovative therapeutics for people with life-threatening diseases. Gilead seeks to improve the care of millions of patients living around the world, including regions where access to medicines is limited or does not yet exist. Thank you to Gilead Sciences. And we are offering educational credits for today's session. To be eligible for those credits, you must attend the training for at least 60 minutes and then complete the evaluation by 5 p.m. today. The link to the evaluation will be shared in the chat several times through the session. You can also access a QR code on your PDF program that was emailed to you on Friday. Each QR code will take you to that day's evaluation. And if you're seeking CMEs, contact Mary Beth Donica at the email listed there. That email will also be put in the chat a few times, and that email is in your program as well. Disclaimer, this program is supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services as part of an award totaling $4,198,345 with 0% financed with non-governmental sources. The contents are those of the author and do not necessarily represent the official views of, nor an endorsement by HRSA, HHS, or the U.S. government. And these are some AETC resources for continuing ongoing education around HIV and hepatitis C that goes on throughout the year. Those links will also be placed in the chat for you as well. And now on to disclosures for CME purposes. None of our planning committee members have any financial disclosures, and none of our speakers or panelist members for today's sessions have any disclosures as well. And this is just some additional information on disclosure statements and disclaimer statements related to the CME process. And with that, we're on to today's session. Community-informed rapid response to an HIV cluster, moderated by Linda Sider. But before we get to the panel discussion, we're going to have Zoe Peach, health educator with Caracol, go through some slides to give you some background information on data and what Butler County is and kind of where things started. So with that, I'm going to hand things off to Zoe. Thank you, Zoe.
Thank you, Adam, and good afternoon, everyone. I just wanted to take this opportunity to give some orienting slides about some of the background in Butler County that those of us that have led the response to this cluster have faced. Next slide, please. So Butler County has a population of just under 400,000 people. So it's a rather large county, especially for me. I grew up in a county of 12,000 people. Butler County is part of the Cincinnati metro area, although the northern portion of the county shares a lot of similarities with the Dayton metropolitan area and has a lot of interactions with the city of Dayton. So it's approximately 20 miles north of downtown Cincinnati, and it's about as far south of downtown Dayton. So in the southeastern portion of the county, it has a lot of suburban development. In addition to that, though, there are 2 post-industrial Rust Belt small urban centers, the cities of Hamilton and Middletown. Hamilton had a population in 2020 at 63,000, and the city of Middletown had a population of just under 51,000. Those two towns have a long industrial history and were hit really hard by deindustrialization in the 1980s and 1990s. Middletown has a long history in the steel industry. There's still a large AK steel facility there, but the number of jobs there has been cut dramatically. In Hamilton, it has a long history of being in the paper business and the tool and die factories. And those too significantly were cut back in the 80s and 90s and really affected both of those towns, which experienced significant population loss at the time before rebounding in the 2000s with some of the suburban influence from Cincinnati. From a political perspective, and especially for those of us in public health, things are a little bit complicated. Butler County is served by 3 different health jurisdictions. The city of Hamilton and the city of Middletown have their own health departments. And then the Butler County General Health District serves all areas outside of the city limits of those 2 counties. To make things even more complicated, Hamilton County Public Health, which is home to Cincinnati, is assigned to HIV and syphilis for Butler County, along with 7 other counties in Southwest Ohio. Caraconference, the organization that I'm with, is responsible for the community-based HIV services, including HIV testing and case management services. A lot of the folks in Butler County can tie their familial history to the Appalachians. And even though Hamilton, Middletown, and the rest in Butler County are not technically in traditional definitions of Appalachia, they're often considered a part of urban Appalachia, given the strong pipeline of folks that migrated from the mountains of eastern Kentucky and West Virginia to Hamilton, Middletown. I hear that so often from my clients that they can tell me about their family history in eastern Kentucky, since I myself come from Kentucky. So I often use that as a little bonding tool with my clients. Next slide, please. So to give a brief overview of the epidemiological side of things, Butler County has an elevated rate of hepatitis C virus compared to the statewide average. And it's significantly higher than the 3 largest counties in the state of Ohio, which are Hamilton, home to Cincinnati, Franklin, home to Columbus, and Cuyahoga County, which is home to Cleveland. Butler County, through this point, in 2020 at least, has had a below average rate of persons living with diagnosed HIV infection. However, this one is another significant flag that flagged us to the potential for a cluster of new HIV or hepatitis C infections. There's a significantly above average rate of unintentional overdose death in the county. So there's 56 deaths per 100,000 people, compared to a statewide rate of 45.6 and a national rate of 14.6. So these fatal overdoses are especially clustered in Hamilton, the 45011 zip code, which is the east side of Hamilton, east of the Great Miami River, and 45044 zip codes, which is the southern half of the city of Middletown. Leading up to this, in 2019, there were 24 new diagnoses of HIV in Butler County, which is roughly equivalent with other counties of the same size throughout the state. Next slide, please. So before we delve into some of the details of the cluster in Butler County, I want to give a little bit of history of what clusters and outbreaks of HIV among persons who inject drugs have looked like over the past few years. This really came to the attention of folks working in the public health space in 2015, when there was a very large outbreak of HIV in Scott County, Indiana, which is a county of only about 40,000 people. And there were 215 new HIV cases diagnosed in Scott County related to an outbreak of HIV among persons who inject drugs in 2015. There was a large cluster response, a large outbreak response, which you can find a lot of materials ad nauseum about that. However, as an update to that, some of the political challenges we see in this space, In June of 2021, county officials in Scott County voted 2-1 to close their syringe exchange program. More recently, there have been outbreaks in Cabell County, West Virginia, which is home to the city of Huntington. And most recently, there was an outbreak in Kanawha County, West Virginia, which happened from 2019 in through 2020 through the beginning of the COVID pandemic, which was quite a challenge for public health response. So we've noticed through these other outbreaks that have happened elsewhere across the nation, and there have been some in urban centers as well. There was an outbreak in Lowell, Massachusetts, which is just to the northwest of Boston, and a particular neighborhood in Seattle, King County, Washington, also had an outbreak. So through these different outbreaks, we see that communities of persons who inject drugs that are sharing syringes, often small, close-knit, insular communities, are exceptionally vulnerable to rapid HIV and hepatitis C transmission. So with all of that said, the CDC came out with a wonderful document meant to be sort of a guidebook to responding to these sort of outbreaks in March of 2018 that's very geared towards state and local health departments. And we've utilized that publication in the response to this outbreak in Butler, to the cluster in Butler County. Next slide, please. So now this is what it looks like in Butler County. And we'll go into a little bit more detail, of course, in the panel discussion. In March of 2021, Hamilton County Public Health, who we're glad to have on the panel today, alerted the Ohio Department of Health and the 3 local health jurisdictions in Butler County about a dramatic increase in new HIV infections among persons who inject drugs. There were 5 new diagnoses by March 18th of 2021, which in 2019, of those 24 new diagnoses that I mentioned earlier, only 3 of those were tied to injection drug use as a factor. So these new diagnoses were recorded at the different hospitals in Butler County, which also has some complication as well, since some of the Cincinnati area hospitals serve Butler County, which those of us at Caracol had close relationships with the Cincinnati area hospitals. But Butler County is also served by the Dayton area hospital systems, which we didn't have as close of a relationship with. The new diagnoses were also recorded at numerous drug treatment facilities and at the syringe service programs in Butler County. There were 2 syringe services programs in operation in Butler County at the beginning of the cluster. There's one in Middletown and there's one in Fairfield. So just to further reinforce how much this affected Caracol, in 2021, Caracol ran a 5.1 positivity rate, meaning that 5.1% of all tests that we did in Butler County came back positive. And this is compared to 4.1% for all of Caracol sites across Southwest Ohio. Normally, we average around 1.5 to 2%. And for those of you who were on yesterday's session with our friends from Chicago, they ran a positivity rate of less than 1%. So this goes to show that there was a significant new cluster that emerged. So in 2021, there were 59 new diagnoses of HIV in Butler County, and 59% of those were among persons who inject drugs. So far in 2022, the raw number of new diagnoses is down significantly, but still 58% of those new diagnoses were among persons who inject drugs. Next slide, please. So I want to give a little bit more setting to what we were working with as we began responding to this cluster. COVID, as it has been for all of us, was a significant barrier leading up to the cluster response. Outreach that Caracol and our partners did had been significantly curtailed due to COVID-19, but testing and outreach was still ongoing at the syringe services programs, which allowed us to establish relationships both with clients and some of the community partners. However, the Middletown syringe services program location changed multiple times and changed multiple locations on those occasions as well, due to some political factors and community pushback. So that led to a lot of confusion among folks who were utilizing the Middletown syringe service program. We learned from our epidemiological data that those initial infections in 2021 were especially clustered in the city of Hamilton. However, 45011 as a zip code, which we see on the epidemiological side, refers to a pretty significant area of Butler County. So we talked to the folks that were attending the Syringe Services program, and we learned that many of the folks that were testing positive frequented an area called East Avenue in the city of Hamilton. So we decided to go down there as the different partner agencies formed a partnership, and we decided to go to East Avenue and start doing some foot-based outreach that was very community-driven. A number of community members that we had tested went on to recruit others for testing. There were a few instances where myself and one of my colleagues did testing out of backpacks on East Avenue when the temperature allowed for it. And as soon as we were done with one test with one client, the client would yell at their friend across the street, hey, come and get tested. And we would proceed to test them, perhaps on a stoop. So this was some shoe leather epidemiology, if you will. At first, we didn't have a lot to offer other than Narcan and some very limited wound care supplies, especially since we didn't bring Caracol's van with us or any other kind of mobile outreach vehicle. It was just backpacks with whatever we could stuff in them. Further, there were lack of resources for those of us doing testing to provide any kind of consistent follow-up with our folks. Next slide, please. So that's where this wonderful partnership and coalition of organizations came in. It was a bit cobbled together. It was very informal that all of these different organizations came together to respond to this outbreak, whether it be the public health jurisdictions, Hamilton County Public Health, and especially the Butler County General Health District, the Regional Harm Reduction Collaborative, which was at the time responsible for the syringe service programs in Butler County, UC Health, which is a hospital system affiliated with the University of Cincinnati. We tried a number of innovative practices with them, which we'll talk about a little bit later in the panel. And we also allied with some community organizations that were doing the work on the ground far, far before us, and will be doing that work far, far after us. One of those being New Life Mission, which is a local meal center and purveyor of a lot of other supplies for folks experiencing homeless in Hamilton. And then there's even a small outreach ministry that we formed a very strong alliance with, and specifically with one of their members that helped us reach a lot of folks that we didn't know how to reach otherwise. And the Community Health Alliance, that includes several of the treatment facilities that are present in Butler County, along with the PATH Homeless Outreach Team. So these partnerships have led us to where we are today. And with all of that said, I would like to take this opportunity to introduce Caracol's Chief Executive Officer, Linda Sider, who's going to lead us through the rest of this panel discussion.
Thanks, Zoe. And hi, everybody. Thanks for joining us today. One just quick housekeeping thing. My office is on a very busy street, and there are sometimes sirens. So I will try to mute when that happens, because it always happens. But again, welcome, and we're so glad that you're able to join us today. The panel that we have today couldn't be better. They have extensive experience on both prevention and care sides, so it should add to a really rich discussion. So I'd like to introduce the panel right now. We have Ronte Bass, who is Supervisor of Harm Reduction Services, Butler County, the Regional Harm Reduction Collaborative. We have Todd Rademacher, who was with Hamilton County Public Health. He's a DIS supervisor. Valerie Costello, medical case manager here at Caracol, and Rob Geller, who is a prevention supervisor here at Caracol, working with our harm reduction team. So welcome, everybody. And again, thanks for joining us. So the first question I have is for Todd. What made you think that there was a cluster in Butler County? What first alerted you and was of concern?
I think a little bit was a combination of things, a little bit of PTSD, because we had just come out of a cluster in Hamilton County, which kind of, I would say, crept up on us, but it was something that we weren't used to at the time. So in 2017, previous to that, people who inject drugs accounted for the single digits percent-wise of our total overall Hamilton County infections. And then, leading into 17, 18, 19, they became a third of our infections. So from like 12 cases a year to 60 something plus cases a year. So at that time, we were still, obviously you knew there were other public health issues going on in 20 and 2021. So there was a lot going on, but we were still kind of coming out of that cluster investigation. So I was still doing monthly reports for ODH, for the CDC, as far as just updates on, case counts, as far as how many people were engaged in care, partners identified, that kind of thing. So at the end of, so in 2020, we only had one individual that injected drugs in Butler County identified as being positive. And that just happened to be at the very end of the year. And I was doing the January report for Hamilton County. And in doing so, I noticed, oh, there's another case in Butler County. So within a month period of time, we went from one case total in a year to in January of 21, we had now at 2 cases. So I was doing my monthly report for Hamilton County. I said, oh, just, this may be nothing, but just a heads up, we've had, 2 cases within the last couple of weeks of each other. And then, February came, we had another case. March, we had 2 cases. And then April 3, and just kept growing from there. So I just happened to be fortunate enough that I was keeping hand counts of the new cases there as they were identified as a result of our Hamilton County cluster. If we truly had to wait for surveillance like ODH and overall surveillance, quite often those numbers are delayed by months because risk factor information and the data systems they use to pull out of quite often are several months behind the reality of what's going on the ground. So, thankfully it was just a lucky coincidence of errors, so to speak, that we had come out of an investigation and we were, I was just, happened to be keeping track by hand in all the counties because we also have other counties, Claremont County, other counties, we just want to keep an eye on. So it was just, I wanted to raise the alarm as soon as possible.
Thank you. So Rob, how did Caracol first learn about the cluster?
I would say, well, so as Zoe kind of alluded to, we'd had a presence in Butler County for several years, mainly providing testing at the Middletown syringe service program. And, generally speaking, we would perform tests, not get a lot of positives. If memory serves, I want to say like Zoe may have had a positive, once in 2019 or 2020. And then at the time, early 2021, I was the primary tester going to that site specifically. We had another site up in the Butler County General Health District. Well, one week, I think I had 2 people test positive in one day at that site, which was abnormal and a little bit alarming. And then about a week later, we were up at the Butler County General Health District site. So this is so the first 2 in Middletown, and then now we're in Hamilton. Somebody test positive there, and all the people that were testing, those 3 people were, their primary risk factor was injection drug use. And then it was kind of like, oh, Zoe and I were looking at each other like, oh no, this seems to be a pattern that's developing very quickly in a specific group of people, and it just kind of kept going from there. So people, you go from not really testing anybody positive to it felt like every other person all of a sudden was testing positive. It was just kind of like waiting for the next shoe to drop, and it just kind of continued that direction. And as Zoe touched on, then we moved into like more backpack outreach in a very specific area, and then within a week or 2 of doing that, there was yet another positive, and then another, and it just continued from there.
Thank you. Well, and it's a good thing, like Zoe described, that we already had relationships in that county, so that when we needed to step our response, we were able to do that and already had some credibility with the people who live there. So Ronte, could you talk about the Regional Harm Reduction Collaborative and the role that you played in the early stages of the cluster?
Yes, first of all, I'd like to say thank you for having me here today. It's an honor to be here. So I started in April 2021. So I'm kind of piggybacking off of what Zoe and Rob had already said. So when I came in onto the team for Regional Harm Reduction Collaborative, I was getting updated on, like, there were some positive HIV tests going on in Butler County and things of that nature. So one of the things that we did, or we do, we're kind of like boots on the ground. We go to Hamilton, we're in Middletown, kind of all over Butler County, on the streets, doing outreach, meeting people, seeing what's going on. So when I first heard the word cluster, I wasn't sure what it was either. Guys, I was like, wow, what is this? So me and one of my coworkers, we were out with some assistance from Sojourner out on East Avenue doing some outreach, and we were involved in some testing. And that same day, there were a few people that tested positive, and then it was kind of like, oh, wow. And then that person would say, well, I need to let this person know, and this person needs to get tested, and then that person would come, and then there you have it. There was multiple people testing positive for HIV. So in the regional harm reduction world of it, though, we're just boots on the ground trying to establish rapport with people. What I've learned over my 28 years of doing this work is, though, you only go as far as the relationships let you. If you don't build a rapport with the people that you're working with, if they don't know you or begin to trust you, or at least like you, then things can't be done, because those are the people that let us know, well, go here, check this area first, go here, tell that person that us, we'll help you with that. So that's where we are. And that's how we get everything going. It's boots on the ground, but it's rapport building.
Yeah, it's all about relationships.
Correct.
Absolutely. Thank you. So Valerie, you've been a case manager in Butler County for years. You were a case manager in Butler County before you came to Caraconference. So that county and the resources that are available. Could you talk about, give us some idea or context in terms of what the social service network is there in healthcare, particularly for people who inject drugs, but just kind of talk about the healthcare landscape there?
Yes, that, as Zoe spoke into, Butler County is a large county, and some rural, some urban. So the services are quite scattered in terms of social services and specific to certain areas sometimes. So that's kind of a loaded question in the sense that, if someone is in the Hamilton area, there certainly are services available. The obstacle that we tend to run into with people obtaining healthcare services are the fact that they are people who inject drugs. One, they may not want to go into the facility. They don't have any resources to get to the facility, those types of things. There certainly are federal qualified health centers where they could obtain services for medical care. But what our primary focus has been in terms of helping these individuals in Butler County is trying to, like Ronte said, engage them, establish a rapport. We have to gain their trust first, so that they begin to ask us to assist them. And since we've had a cluster outbreak, our primary focus has been trying to make sure that we get those individuals into healthcare, specifically as quickly as possible into HIV medical care. The challenge with that happens to be that the closest infectious disease place that we can send them to is either in Dayton or Westchester, which is neither one are close proximity to either Hamilton or Middletown. Now, most of our individuals do have Medicaid coverage, and we've been able to get them into care that way. And our primary focus is to try to get them into UC Health for their care, because we have an ongoing relationship with them so that we can help then begin to, schedule appointments for them or monitor, if they've been there or not been there. Yeah, that's been the primary thing that we have done with people. In terms of social services, we work closely with Transitional Living, which has the PATH team for the homeless outreach, to work with individuals, and Access Counseling is another one. They're very helpful with not only mental health counseling, but possibly getting people into treatment or housing sometimes. Yeah, and the best thing I'd say we can do, or we do on a regular basis with these individuals, is providing support and continuing to engage them. I can give an example of one individual that we've been working with for as long as I've been doing this. And I started doing this back in the spring of 21. This individual, we've gotten him into care, and now he's ready to get into treatment. So that to me is great progress, but it's taken us 1.5 years to get to that place. I know that's kind of a roundabout answer to that question.
Not at all. Not at all.
But yeah, okay.
Yeah, it's a time investment. It is. I mean,
It's a time investment,
yes,
certainly. Relationship building.
absolutely. I mean, that's a theme. Absolutely. And the other thing is, like, for years I worked in Butler County, and I'll tell you, and I think this is still true, transportation is a huge barrier for people. There is not a really good bus system that connects different parts of the county. And so that's a big barrier.
And I will say that most of the individuals that we have been working with do have transportation through Medicaid, but the bigger challenge with that is, one, they have to have an address where the Medicaid can pick them up, and two, they have to have a phone, and they don't always have a phone. So, yeah, and we have done some assistance, transporting people to appointments to make sure they get, started in care. And we'll do that, for other appointments as well as needed, because we want to move these people forward and, help them get to an undetectable level so that they have longevity.
Yeah, it isn't about just handing somebody a card and saying, here, go to this service. That's not at all what you do. I know. None of you do it that way. Yeah. No. I mean, it takes a lot of hand holding and walking through systems with people. So thanks.
Yes.
So, Zoe, could you talk a little bit about what kind of reactions have you gotten when people test positive?
Yeah, absolutely. So like Rob mentioned a little bit earlier, I had been one of our primary testers up in Butler County ever since I started in this position about 5 years ago. And through that, Caraconference also provides testing for hepatitis C virus. And a lot of people tested positive for hepatitis C with me through our program. Normally, when folks were tested positive for hep C, it was pretty common that folks would brush it off, that it was not their number one concern. They had other priorities to deal with first. When HIV came along, it was a much different story. One with hepatitis C, they would say, oh, okay, and then walk directly out of our testing area like nothing had ever happened. When Rob and I were starting to diagnose folks with HIV, they had some very strong emotional reactions. There was one time that I recall a client, when we were testing through backpack outreach out on East Avenue, cursed us out, was yelling at us, yelled at her friends who told her to get tested, said she never wants to see any of us again. But about a month later, she came up to us when we were doing outreach, and she was profusely apologizing for how she had treated us that day, to which Rob and I both responded, it was an emotional time. It's totally okay. We understand. We don't take it personally. So we've experienced that where folks did come back, but we've also experienced a number of times where we haven't had a continued connection with folks. There's many folks that first test positive with us, perhaps towards the beginning of the cluster, that we haven't heard from again. Unfortunately, since we're working with a population that's injecting drugs, there have been several of our clients that have tragically passed away. And that's been tough on all of us as service providers, but it's also, it really reminds us of how tough it is on the communities that we work with, since in addition to worrying about HIV, worrying about hepatitis C, folks are worrying about overdose. Folks are worrying about soft tissue infections, which we see a lot of up in Butler County as well.
Thank you. And you brought up an important point, the relationship with HIV injection drug use and hepatitis C. Can someone address, like, it seems like, I mean, there's a really clear sort of standard of care and referral system for people with HIV. How do you work with someone with hepatitis C? Where do you refer them for treatment and care? And it makes perfect sense. You're saying that this is not like a top priority for people, but I'm sure you do have some, at least, advice in terms of helping people get started now that hepatitis C is curable.
I'll attempt to answer that question. I mean, so a couple things at play. I mean, there is a cure for hepatitis C. It is notoriously difficult to receive or to have access to get access to. And some of that comes from kind of historically, the policy here in Ohio has been that hepatitis C care can be denied to somebody based off their status as somebody who uses drugs. Basically they can't receive care until they've been sober or abstinent for 6 months. In addition, basically their liver counts would have to get so bad before they can receive that treatment. Now, luckily, so first of all, I think a lot of people knew that. Luckily, those restrictions have eased up a bit, so it's no longer that somebody's required to be abstaining for 6 months. There's a certain viral load that is required, but so anyways, we have that kind of, people remembering that. I think people remember, or maybe have heard stories about the older treatment for hepatitis C, interferon, which is pretty rough on the body. And so there's a little bit of that at play. And then you're talking about navigating, especially if in situations where people are maybe living on the streets in their day-to-day is kind of unpredictable. We've already talked about lack of transportation, lack of phone access, things like that. Navigating, essentially the route would typically be somebody's test positive for hepatitis C. They go to see a primary care physician who then refers them to the type of specialist that would be required to prescribe hep C treatment. Well, that's a lot to navigate for somebody who's maybe not engaged in any form of medical care, or maybe their only experience with medical care is when they're going to an emergency room for an abscess and getting treated like garbage by the staff. That's a story that we've heard. I'm sure a lot of people have heard time and again, just a lot of that stigma playing a role. Luckily, we have we've developed a great partnership in the last 12 months here with a group called Central Outreach that is providing really essentially on-demand hepatitis C treatment by mail. As long as somebody has an address, they can have that sent to, and they can have their blood drawn. This team will do lab work in people's homes, in people's camps, whatever's needed. They're just been an absolute boon. Now, I will say that specifically our work with them they're coming from West Virginia. They come a long way, and whole clinic hours all around Hamilton County. So I can't speak to how much presence they have up in Butler, but it's pretty hopeful, the fact that that's even an option right now. Did that answer your question, Linda?
Oh, absolutely. That's amazing that there's that resource for care. Yeah. And that brings me to another question. Like, we have all these great resources. You all are an amazing team in terms of serving Butler County and really responding to the needs there. But how do people find out about you? you know, people who inject drugs are not necessarily plugged into traditional channels of communication, I would imagine. How do you market your services? How do you let people know that you're there? Now, some of what we've done is we partnered with Hamilton County Health on marketing services in Butler County. But go ahead, Rob. Sorry, I cut you off.
Oh, no, you're good. I was just going to say, so we did work with a marketing firm to basically put up some billboards coming into like Middletown and Hamilton, specifically some main thoroughfares that advertise the service, advertise the need, I guess. And then I'd say in addition to that, there was one or two print articles that had come out. And I don't know that we sought after those necessarily, but some articles about the rapid increase, specifically in Middletown, if memory serves, that had come out early 2021. And like, I think that article mentioned a specific percentage, and it was like, you know, within a couple of weeks, that percentage was on everybody's tongue at the syringe service program. Like people saying, oh yeah, I heard that it's really getting bad. I heard that it's getting worse, all that kind of stuff. And yeah, and this is not to speak, of course, you know, our marketing director does a really good job of being active on social media. So, so Facebook, et cetera. And all this was in partnership with Butler County General Health District as well. So they also were at the table to provide, basically advising us as to what direction we'd go.
And I would imagine once you start to get the word out, I would imagine there's a lot of word of mouth in those communities. Like, hey, you can trust these people, or they'll help you with this. That I would think makes a difference as well.
Absolutely. We tried a lot of different, very innovative practices that we just kind of threw at the wall when it came to marketing. We also tried some what are called geo-fenced advertisements, which was we would pick out a specific location, whether it be a homeless shelter or something similar, and we told our partners at the marketing firm, hey, can you advertise our services to people in this specific location? And that worked as well. We didn't hear a lot of folks specifically citing that, but that was one of the things we used in addition to social media. And we even did some good old-fashioned flyers. We heard from a lot of the folks in the beginning of the cluster especially, that they just didn't know that HIV could be transmitted through sharing needles. So we made a flyer that had the locations and times we were at on one side, and on the other side, it just said, did you know sharing needles can spread infectious diseases like HIV?
Well, that's a good point. And that brings me to another question. Again, while you're providing all these interventions to get people into care, get them tested, how much education do you do in conjunction with your outreach efforts? Because I think you bring up an important point. I mean, you would think most people who inject drugs know that they're at risk for HIV or hepatitis C. Not necessarily true. So how do you weave education into your interventions? And I'll ask that of the whole panel. Anybody who wants to answer?
I can speak up a little bit. So, obviously at the time of someone getting their results, quite often they're not hearing much. It's not necessarily always a good education opportunity. Yeah, they're dealing with the emotions. Several of the testers experienced people that literally ran after they got the results, and we didn't see them for weeks and or months sometimes. But actually, that someone attending this conference today is Cameron Grolmus, who is one of our disease investigators, who is the job of the health department anytime we get a new diagnosis of HIV, is to one, contact them as far as getting them linked to care, but two, to also talk to them about their partners and who their either sexual contacts may have been or needle sharing contacts, and which usually that's not at the time of the diagnosis, but quite often Cameron was the one that was diagnosing people because she was testing their identified contacts. A great resource for us has been the jail. Love it or hate it. That's where we found a lot of our folks. They don't have a phone. They don't have a residence where we can locate them, but we do regular searches of the different detention facilities up there. And, sometimes they are in a little bit better state at that time. They are not currently actively using. They're not, potentially sometimes we wait a couple of days, so they're not necessarily feeling super sick at that time when they're detoxing. And then, quite often she's up there weekly, meeting with them one-on-one. And the jail, has been a great resource for us as far as the engagement and care process, getting them to the appointments. It is a 45-minute trip from where that jail is to where the main hospital we're taking folks are. And so they're taking their resources, transporting them there, and Cameron actually just found out recently that, she may or may not be able to speak up on this, but I believe the stat she told me that currently at the Butler County Detention Facility, 70% of their medication budget is going towards our HIV positive clients that are there right now. So their overall budgets of, I don't know how many hundreds plus thousands of folks are currently housed there. This is a huge expense to them. We are very lucky in Hamilton County that we have the indigent care levy, which is what we can rely on as far as, people getting medical services while they're there. But Butler County doesn't have that. So that is a big stumbling block for us. And we are currently in the process of trying to get it so that we can use Ryan White care dollars for care while they're currently there. Because, the only way we're going to be able to get them to be able to step up our access as far as testing folks while they're in detention is to be able to find a way to make it, financially feasible, because every time we identify somebody new that's positive, that's several $1,000s a month more to their medical expenses. So that's something we do need to take in consideration.
I never thought about that. That makes good sense. And you're right. We are lucky to have the indigent care levy here in Hamilton County because we have a way of getting things paid for that other counties don't necessarily. So I guess part B of that is, it sounds like with, your relationships with each other and the work you do. I mean, it's a big county. There's a lot to cover. Some of it's rural, some of it's city. There are two big cities that are pretty separate from each other. How well integrated do you feel as a team that you are with the other social service agencies? Valerie mentioned federally qualified health centers. Are there other types of agencies that you really rely on to help with your early intervention work and care?
I would say that we have a stronger relationship with a lot of agencies in Hamilton than we do in some other areas of the county. I mentioned earlier in the partnership slide, New Life Mission and Community Health Alliance and SLIM. New Life Mission, we've even tried something new there. In the past few months, our case management team has established office hours at New Life Mission. So I feel like in Hamilton, we have a pretty strong relationship with a lot of the providers, but we struggle with that in the rest of the county. And Valerie, go ahead, you can add on to this as well.
Yeah, it is a challenge with the social services, like Zoe said, in Middletown. Hamilton is pretty well established. Middletown, on the other hand, is not so much. And Middletown is very sprawled out. Again, transportation is a huge, huge issue for people when we're trying to work with individuals and send them to locations that might be helpful. Again, I think the thing that I come back to again is that most of them have Medicaid, which really helps to get the medical piece. But for social services, in order to get any, assistance from any place else, they usually don't have an ID. They usually don't have an address. I mean, we're talking about people who are living on the streets and injecting drugs. So it's, it's a challenge. I mean, they can't usually get services from any place else other than, us, or the PATH team will work with them, which is wonderful. They do homeless outreach, and it's a wonderful group to work with because they actually can get individuals identification. We also used to have people giving people phones on East Avenue for a while, which was a great resource because then at least individuals could have a phone. But in terms of social services, it's hard for them to get anything anywhere in Butler County. terms of social services because they don't have the basic things that we all take for granted: identification, place to live, those kinds of things.
Yeah, and then also, and this has been somewhat addressed, is just the stigma related to drug use, particularly injection drug use. And I think what's so amazing about this team is when people meet you, they are probably surprised, somewhat surprised by how you meet them where they are, that you don't judge them, and they're not shamed in some way. And I just think that you can't deny how powerful an experience that is for someone who expects that. And that's not what you do. But that really is the start of the relationship. Anybody else have any other comments about the social services and healthcare context that you're working?
I was
Hey,
just
Linda.
going to say that, oh, I'm sorry.
Go ahead,
I was
Valerie.
just going to say, oh, okay. I was just also going to say that Rob kind of threw a little something in there in terms of like the treatment, you know, the stigma. The stigma is huge, especially when it comes to their health care. You know, if they go to the ER, I mean, we've had people come back and tell us that they just didn't really treat them and kind of just threw them out, which is so sad, especially when people are going there and we're suggesting they go there, maybe for an abscess. You know, endocarditis is a huge issue within this population. So.
We definitely have to give a shout out to UC Hospital and the infectious disease clinic down here in Cincinnati. You know, some of our clients and our patients aren't, you know, always the most punctual or reliable as far as attending appointments. We have individuals that no-show 5 to 10 times before they actually show to an appointment. Many providers aren't going to tolerate that. They're like, no, we're not going to see it anymore. You know, so, and they have been amazing. I mean, there was a time we were trying virtual intake appointments from the exchange. They were always there with us, trying just how to meet them where they're at. Just, you know, they were doing a virtual appointment, then putting in lab order sets so we could hopefully get them to a local, you know, draw site to get their labs done. You know, just looking at any options we could to get them into care as soon as possible. So Tammy, Dr. Robertson, quite a few other folks, I can't, you know, thank them enough for the lengths they've gone to.
I just want to shout, I want to hear from Ronte. I saw him come off mute a little bit, and Ronte has been working in the community for a very long time, and is one of those people that if you walk around with him, like, and you meet another, come across, you know, whether it's old clients of Ronte's or other service providers, like chances are they know Ronte. So I want to hear from Ronte if that's cool.
Oh, thank you, Rob. I appreciate that. Put me on the spot. Yeah, I appreciate that. No, yeah, no, honestly, guys, you know, as we sit here and I listen to everyone talk about it, and Zoe, Rob, and Todd, and all of us have been working really close together, Valerie, over the last year and a half, you know, and when it all comes down to, you know, and our clients, they're unique, right? Because our clients, only thing they know is hustle, is how to hustle, okay? So they're not always out to hurt us or hurt themselves or hurt anyone else, but that's all they know. They hustle every day. You know, that's all they know. So they do what they have to do to survive. So when we talk to them and we build that rapport with them, as we say, and all that, and that trust to work on that, it goes a long way. You know, you meet with someone the first month, 6 weeks, and they kind of look at you like, yeah, you know, I don't believe a word you're saying. But then 7.5 months down the road, you know, we're walking down East Avenue, and then those people, you know, that person, that male or female, comes up to you and says hi before you can say anything. You know what I mean? So what we do is very challenging, is very unique. And I would say I've learned a lot on East Avenue with Zoe and Rob and Jennifer Williams, if she's listening. You know, we used to go out to do outreach, and we would go to camps, and we would walk down railroad tracks, you know, and try to establish rapport with people, kind of check and see how they're doing, if they needed anything, you know, and just try to get them to come to an SSP site, you know, and reach out. And then if they come to the SSP site, you know, which you guys know, if they come, we have information for treatment facilities, inpatient, outpatient, counseling, therapy, whatever is needed. We have those things there. It's just an ongoing great thing that we do. I'm ecstatic to be working with this team that I work with and the people that I work with every week and get to see. Now I will say sometimes I had to pull Rob out a little bit and say, no, Rob, we got to keep our head on a swivel. We can't do that, but that's the great thing about working with different people, sometimes it's like head on a swivel. We got to do this. We can't do this. But then you have the other person that's like, oh no, it's fine. We can go here. Let's do it. And it works out, and you help everyone out, what everyone can and can't do. And that's what makes it so well. And I think that's one of the successes we've had in working in Butler County with the cluster and getting people involved and building those rapports. And just to piggyback, off of being able to establish billboards and things of that nature. I hate to say I'm old school. I know I'm not that old, but in some things I still feel that way. But I think word of mouth is the biggest thing when it comes to the population that we deal with. If they trust you, if they like you a little bit, then they will pass that on to the next person, and it kind of goes from there. So, I just kind of wanted to say a little bit of that. Thank you, Rob, for getting me on there. But what you guys do is great work. Todd, you do some good stuff as well. So we're a team and we work together a lot. And so we just keep putting up the good fight.
Thank you, Ronte. So there are really kind of three themes in this hour that I've heard is one, relationships, partnerships, not doing this alone, and most importantly, not waiting for people to come to you. You go to them, and just how important that is. So we only have just a couple minutes left, but for anybody out there who, in other communities who may want to replicate what you're doing, what advice do you have?
If you've got an idea, try it out. If it doesn't work, that's okay. Move on to the next one. There are a number of different examples of that we tried with some different practices. Todd mentioned the virtual appointments that we did with the UCIDC. There was also one time last September on the note of phones, since one of the barriers that we often encountered is lack of communication with folks. Todd was able to secure a supply of phones that we distributed to folks. If I remember correctly, and Rob, you can help me out on this one too, 5 of those 6 phones were gone about 48 hours after we gave them out to folks. So that was one of those things that didn't work, but we tried it. And one of those phones someone does still have, and we're able to use that to communicate with that client. Those virtual appointments, they worked for some folks, didn't work as well for others. So there's my advice. If you've got an idea, try it out.
Yeah, and I would just say something that we're trying to learn from this. So maybe take this and apply it to whatever your scenario is or whatever your area of expertise is. But something that we're trying to learn from this is being a little bit more prepared and having an internal plan next, like if and when this happens again. So internally here at Caracol, a few of us are meeting regularly to kind of put together that plan, that cluster response team or whatever, so that next time we're not, so much of what we have done in this case is something that we've figured out sometimes slowly along the way. And so we're trying to not quite be like on our heels as much if and when this happens again in an area that we're responsible for, I guess. So that's all.
I think a couple of things to just keep in mind is to always, meet the clients where they are. And that means in their own space as well. We can't expect them to come to us. We need to go where they are. I think that's why we've had such great success is, we've been in areas where they are. And being at the SSPs too obviously helps because we're drawing them in for that. Then we have the time to, chat with them and hopefully help move them, test them and, move them forward, hopefully.
Thank you. Well, we're almost out of time. So thanks everybody for joining us today. And for those of you that are attending the conference, feel free to reach out to us if there's any information we can share with you in terms of the work you do or the community you live in, things we've tried that have worked and things that maybe didn't work so well. So we're always available to talk. So at this point, I'm going to turn it back over to Adam Riley. Adam?
That was great. Thanks for that conversation, everybody. I'm really, yeah, I think that was such great information, and we're getting some good stuff in the chat as well. So everybody that's attending, the evaluation link is in the chat, and so is Mary Beth Donica's email if you're requesting CMEs. You also have that information in your PDF program for the conference that was emailed out on Friday. And we hope to see you tomorrow, where we have a group of people talking about efforts to modernize criminal codes around HIV in Ohio and other areas. So we hope to see you tomorrow, and enjoy the rest of your day, everybody.